Hello everyone, welcome back to my channel. I am Dr. Namarata Agrawal, an ICU specialist, and today we will be discussing about very important yet neglected topic. I would say the people are unaware of this. That is, what is organ donation and how do an ICU specialist play a role in an organ donation. So what is organ donation? Organ donation is a process of giving your organ to somebody in need, and the organ donation can happen from a brain dead patient or a live patient as well. So from brain dead patient, we can take out kidneys, liver, heart, lungs, pancreas, corneas, and from a live donor, we can take out kidney, single kidney, and a part of a liver. So organ donation is very important to save anybody's life. One brain dead patient can save 6 to 7 lives. So I will urge you to research more about this and enroll yourself, your family members and your loved ones into their organ donation. Also, just pass on this video to all your loved ones or near ones and make them understand the importance of organ donation. And you can contact me, you can comment also if you have any questions about the same. Moving forward, we will now discuss the role of an ICU specialist in organ donation. So one of the most important steps that we need to take is we need to identify the potential organ donors by finding out who all have become brain dead. So brain dead are the most important category of patients that we need to find out so as to proceed with the organ donation. Live donors can be anybody. They can be your mother, your father or your partner, provided that all the compatibility match is being done. But brain dead are the patient who can save 6 to 7 lives in one setting. Also, ICU specialist assess the organ functions. Whoever is brain dead, we perform special tests to assess how the organs are functioning, what organs are functioning, what are non-functioning organs, how can we prevent the deterioration of the organ functioning and keep their viability till the organ is retrieved. Also, we need to follow a strict medical protocol to confirm the brain dead. We do apnea test in a patient to label them as brain dead. They need to be done in an ICU under strict supervision and following all the medical protocols. So what is this apnea test? Apnea test is done in the potential brain dead patients where we need to confirm that there is no brain function. So the brain performs the most vital function of breathing. We need to prove that the brain is not performing well and the breathing is not happening to label them as brain dead. So apnea test is done once we identify that this can be potential brain dead patient. We do apnea test at 0 hour, that is now, and we repeat the apnea test after 6 hours. Only after the 2 apnea tests are positive, we can label them as brain dead patient. Apnea test is nothing but a test that is done to prove that the patient is not breathing on its own without the need of a ventilator support. So apnea test also require a team of doctors where we need a neurologist, a neurosurgeon, an ICU specialist and a zonal officer who helps us in the organ donation. So now we will discuss about the process of organ donation inside an ICU. First and foremost thing, we need to counsel the patient once this apnea test is done and we have declared the patient as brain dead. We need to give this news to the family and we need to forward our word about the possibility of organ donation. Consent of the family is very much important. If they say yes, then we can proceed for organ donation. But if they say no, we cannot influence them, we cannot force them to go ahead with the organ donation. Second thing is we need to ensure that all the organs are working fine. We need to review our medical assessment that was done before declaring the patient as brain dead and just before shifting the patient to the operation theater for retrieving the organs. We need to repeat our medical assessment again to look for the viability of the organ. Third thing is we need to coordinate with the transplant team. So transplant team comprises of the doctors who will be performing the surgery of retrieval of organs and another team of doctors who will be performing the surgery of placing that organ inside the body, that is transplanting that organ. So we need to coordinate with the doctors and we need to coordinate with the zonal officer about the allocating of the organs. Like where is the transplant going to happen in the same hospital or is the organ allocated to the hospital or the patient somewhere else? We need to coordinate the transport of organ as well. Fourth thing is we need to maintain the legal and the ethical considerations that comes with the organ donation. All the paperwork, all the consent should be taken properly and have to be filed properly and they need to be sent to the transplant committee. And after the approval from the transplant committee, we can proceed with the organ donation. So now we have come to the end of this video. I would again like to urge you all to read more about these organ donations, to study about this, ask me questions questions, comment below if you have any question about how to proceed with the organ donation, and please sign up for an organ donation before any adverse event have happened, or at least convey to your family members that you want your organs to be donated after you pass away. Also, please spread this awareness amongst your family members, along your friends, your neighbors, everybody, that organ donation is very important. It can save many lives, and we need to keep this in mind that it is for a good cause. Thank you.